painful bilateral, which simply means on both sides, ovarian cysts. And this is in clinic with the 905 nanometer delta. And so let's have a look. For the past 4 years, this lady's had pain in her abdomen at about a level 8. And what that simply means is 10 means worst imaginable pain, and 0 means no pain at all. And so she had an 8 out of 10 pain with what she would describe as radiating and cramping pain. And this happens on and off. And my wife's passing me a note. 1 second, please. Thank you. A little loud. Okay. And so, where was I? Thank you, Avril. So you can see here she described it as radiating and cramping pain, which occurred on and off throughout the month, but was continuous during menses. And not only that, but her menses, her cycle was going for 10 to 12 days instead of the normal 3 to 5. And this was also impairing her sleep throughout the month. And she was taking these tablets called coMra, which is apparently a natural sleep aid. And so this was allowing her to sleep. And as you can see here, she had constipation, was taking Dulcolax in order to compensate for that. And the other therapies involved are homeopathic functional remedy based on her symptomatology. In other words, in Dr. Duntam-Setty's interview with the lady, he determined that this is the type of remedy we'll use in order to work with the situation, and as well use microcurrent. And in this one, because she had depression and was taking Ativan for quite a long time, he used the microcurrent. Brain balance is one of the protocols. So with this, the treatments that were done with the Delta were every second day, 12 treatments, then a 10-day break and 6 more treatments. And what he would do, basically he'd switch the Delta to the 10-minute setting and then treat in the uterine area. And so he would move it periodically from point to point, area to area. And with this, we always recommend, with any kind of treatments, a universal support treatment in order to support the whole body as well as the local area that needs immediate support. And with this, he did universal 5 along with the carotid arteries. So you can see here just this picture of the universal 5 treatment. And so what happened as a result? After 12 treatments, she had a reduction in pain from 8 out of 10, which is very severe, to about a 2. You could say it was pretty much nil, except for she would get some pain and discomfort before menses, which is fairly common. And then after a 10-day break and 6 more treatments on alternative days, what she noticed, what the doctor noticed, is the sleeping disturbance 6 to 4. In other words, 0 is sleep no problem, 10 is very difficult, if not impossible, to sleep. So she had improvement in pain and also down to 1, coMra to sleep in the evening. And so he's also got a program or a plan with her and her general family physician in order to reduce the medications over time, because as the healing occurs, of course, the requirement for medication also goes away. She also stopped taking the Dulcolax because with the relaxation from the pain, and also because, I mean, there's an overlap treating the uterine area and the intestines, treating the gut. So she had an improvement in her digestion as well. And she stopped taking the Advil to reduce pain. And now her cycle is down to a regular cycle from 10 to 12 days to about 4 to 5 days. Not only that, the ultrasound reports have reported that she's had a reduction in the cyst size on both sides. So 38% on the left and the right, about 30% reduction. They're taking a break right now, and they'll commence with another course of 10 treatments and see from there.